Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. Today we are going to be talking about rapid COVID-19 testing. Please remember to like this video and subscribe to my channel. So in this video, I'm going to be demoing a rapid COVID test made by the BD Veritor system. So please know, full disclosure, this is not an at-home rapid COVID test. So at the time of this video, there are rapid COVID tests that are available for you to take home and test yourself. This is not one of those. This is one that's done in the laboratory. It's not a PCR test, it's a rapid test, but it's done in the lab. At the time of this video, it is not a waived test, meaning it's a test that you can take home, and waived meaning it's a test that you can take home and perform it yourself. So not waived, this is one we do in the lab for rapid detection of COVID. So novel coronavirus was first identified in December of 2019. That's how it got its name, COVID-19. Symptoms include those similar to other respiratory viruses, so fever, cough, and shortness of breath. Severe illness and death can also occur from it, and this is a rapid test that we do for it that I'm going to be demoing. So the kit comes with a couple of different things. So it comes with a lot of these flock swabs. So it says flock swabs on it. So these are swabs that are used to swab the patient's nose as our sample. So as laboratory professionals, we don't actually usually go in and swab the patient. This is done by either the patient's doctor or the patient's nurse. And these swabs come in the kit, and we get them as lab professionals, but we provide them either to, you know, if you're working in a doctor's office, we give these to the nurse or the doctor for them to take and keep and swab the patients when they're needed. If you work in a hospital laboratory, these are given to the emergency room department or on the floor, specific COVID floors, for them to swab the patient. So these actually come with the kit, and these are the only acceptable swabs that you can use with this particular system. It also comes with these little extraction vials here. This is where we're actually going to be putting the patient swab in for the testing. All right, and then it comes with the actual the device, the system that we are going to be putting the patient sample in. So we've got two of these because I'm going to be doing 2 samples today. And then I'm actually in a college laboratory at the current moment, and so I don't have access to actual COVID patients. And I don't want to suscept people to doing swabs for this video. So I'm using the Veritor Systems QC. So this is a negative control swab provided by the kit, and this is the positive control swab. So this should give me a positive result, this should give me a negative result, and I'm going to be testing both of these samples. All right, so the patient sample is, you use this flock swab, you insert it about 1 inch from the edge of the nostril and roll the swab 5 times along the mucosa of both nostrils. Then this swab is sent down with the patient's identification to the laboratory, and we test it. So what I'm going to do first is I'm going to label my patient samples. So we would be labeling these with the patient's information. But because I don't have patients, I'm just going to be labeling them negative here and positive. All right. Oh, I'll show you. Positive, okay? So negative and positive. So I am going to go ahead and open up my test kit if I can. There we go. Sometimes they're hard to get open. This is what they look like here. Okay, I'm gonna put these, this can be discarded in regular trash. So this is what they look like. There's a control window, a test window, and then this is where you actually put the drops of the material in. So additionally, I'm gonna be labeling these. So again, I would be putting the patient's information on here, but I don't have patients, so I'm going to label them negative. and positive. Okay, so the first step after I have everything labeled is to remove these little yellow caps on each sample. Okay, again, that's my negative. And here's my positive. These also can be put in the regular trash. Okay, and then I'm going to take the negative swab out. Negative swab, and I'm going to be putting it in the negative vial. And then what I have to do is plunge it up and down up for about 15 seconds. So let's do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. So I plunge it up and down for 15 seconds, and then what I'm going to do is squeeze the tube and kind of twist and pull out my swab to get all that liquid out of there. Okay. And then I'm going to discard my swab. Then I'm going to be closing that cap there. So it comes with a little cap that goes on it. And I'm going to do the same thing for the positive. So here's my positive one. Okay, positive. And I'm going to do the exact same thing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right. 15 seconds seems like a long time. Okay, and then again, I'm going to squeeze it and kind of twist and pull that swab out. And the squeezing of that kind of makes sure that I pull off all the liquid that's in that swab here. And then I'm going to be discarding it and shutting the cap. Okay. Alrighty, so now what I need to do is add 3 drops of each of these tests into this test well. So it's going to go in here. Okay, so I've got my negative. Again, I'm going to compare negative to negative, and I would be doing that in a patient setting as well. So, let's say, my patient's name was John Doe, right? I'd be comparing John Doe to make sure I have the right patient. So I'm going to hold it vertically, and I'm going to expel 3 drops. 1, 2, 3. Okay, same. I'm going to do it with the positive, positive, positive. Hold it vertically. 1, 2, 3. Excellent. So what's going to happen here is the liquid is going to disperse all the way up past the test window and past the control window. And if there's any antigen that's detectable, it's going to come up as a line. So I'm going to set my timer for 15 minutes, and in 15 minutes we'll come back and we'll take a look at these tests. See you in a bit. Okay, well, it's been 15 minutes and we have a negative and a positive result for our rapid COVID testing. So here's our negative, and hopefully you can see. So in the test menu, or in the test window, we do not have a line under the T, right? So that means this is negative, and the C window is positive. So this means that the control is positive. So it's an internal control in here. So this is a negative test. Okay. And then here's our positive test, and it's kind of hard to see. Oh goodness, I don't know if you guys can see it in the video. I'm so sorry. It's hard to see in the camera, but it is positive. So the control window has a much darker line than the actual positive result here. So in the T window, you can see there's a little bit of a line. Hopefully you can see it. I promise it's there. So this is a positive test, and so it is actively detecting that SARS-CoV-2 nucleocapsid antigen. So this would be a patient that has an active infection. So for this particular test, the BD Veritor test for COVID, they have like a little box, this like a little electronic testing box that you actually insert. So you see this, there's like a little arrow. So it gets inserted into this little, like this box that comes with the BD Veritor system. And it actually comes up electronically and tells you positive or negative. So I actually don't have one of those available to me. And I'm not testing actual patients. I'm in a college laboratory. I don't have one of those to show you. However, this is how the test is performed, but you do insert those into the BD Veritor test system. And that's how they recommend and require you to result your results. So in this particular case, I would be resulting this patient as negative, and I'd be resulting this patient as positive, and then I would discard everything in their appropriate containers. Hopefully this video helps you. If you liked it, please remember to like the video and subscribe to my channel. And if you have any other suggestions or comments about any other lab topics that you would like me to discuss, please leave it down in the comments. All right, until next time.